Good evening, everyone. Welcome to another special edition of the Apex of Training and Development Cancer Awareness Program. I am delighted to be your host, Charian Casimir Hudge. This evening's program is sponsored by Nagico Insurances, and tonight we have the lovely ladies from Nagico Insurance in Anguilla joining us to tell us a little bit about Nagico Insurance. Also on the panel, we have cancer survivor Lonette Bell James Knight, and she'll be sharing her story with us, as well as General Surgeon Dr. Serena St. Luce at the Celeste Bird Medical Center. So, without any further delay, I will begin by asking cancer survivor Lonette Bell James Knight, who is a breast cancer survivor, to tell us a little bit about her journey as a cancer survivor. Lonette, could you please unmute your mic?
Sorry. Good evening, everyone. I will have to start with cervical cancer because I'm also a cervical cancer survivor. I was diagnosed with cervical cancer in 2008. And then in 2014, I was diagnosed with breast cancer stage 3B. Uh, as I can say that it has been, for me, I wouldn't say it's a challenge because from both diagnoses, I just went whatever needs to be done. Let's do it. So it wasn't a challenge at all. It's just I guess mentally how I looked at it and the support that I had. It wasn't a challenge at all for me.
All right, awesome. Thank you so much, Lonette, for your experience, sharing your experience with us. What type of support did you get from your family members? So when you were diagnosed, when you were told that you were diagnosed with the cancer, what was it like for you?
Okay, with the cervical cancer, it was in the early stage. I did laser surgery. I didn't tell a lot of persons about that one. I went in, I had my laser surgery. So, but my family was very supportive, and in a sense, my immediate family wasn't surprised, was shocked but not surprised because we had family members who, on one side of our family, who the males died from prostate and the females died from cervical cancer. So it's something that we all have been screening for, my siblings and I. For the breast cancer, when I was diagnosed with that, I had to step up and to be the support system for my family. They all took it, they didn't take it well. Whereas I said, well, I only have two options, is either I'm going home or I'm going to be used by the Lord. So I was the one who stood up for the family. And after a while, I remember one of my sisters says, but if she's taking it like this, why are we acting like this? So it was me being the strength for the family going forward.
Fantastic, fantastic. Testimony, Lonette James. I just want to say good evening to Roberta Ephraim, who is joining us via Facebook Live. Good evening, everyone. Happy to be here as usual. And Roberta is also saying, I have heard Lonette speak a few times, and I must say that I admire her strength and courage. I love you. For those of you who are just joining us via our social media handles, that is YouTube, Facebook, and Twitter. Remember to share the live, invite a family member, invite a friend, let them know that we have Dr. Serena St. Luce here with us and cancer survivor Lonette Bell James Knight, as well as Imogene Taylor, Nagico Insurance representative. So we're going to switch over to you, Dr. St. Luce. You are a general surgeon at the Celeste Bird Medical Center. Tell us a little bit about yourself. You're very new to our program. We've had several medical practitioners from the Celeste Bird Medical Center and other parts of the Caribbean. So, who is Dr. Serena St. Luce? Dr. St. Luce is experiencing technical issues. So, Lynette, we're going to go back to you. So, you spoke about the support that you had from your family and the fact that you were the one that had to be the one filling the shoes of supporting them. What was it like mentally when you went to the doctor and you found out that, hey, you're actually diagnosed with cancer? How did it affect you mentally? What sort of emotions were evoked at that time?
For the cervical, as I said before, yes, it was a surprise, but not a shock. So, and he said it was in the early stage from the onset. He said it was in the early stage, and that it everything could be taken care of with laser. I wouldn't have to do any chemo. I wouldn't have to do any radiation. So I I said, okay, let's do what, and then that was it. It wasn't something that I thought about, worried about. He said what was needed, and that we'll monitor it. With the breast cancer, when I found the lump under my arm, because I didn't feel the lump in my breast, I felt the lump under my arm. I called the doctor the same day, went, he did an ultrasound because he did a physical examination of me and he didn't feel anything in the breast, but he felt the one under my arm. He did an ultrasound, and from doing the ultrasound, he saw the tumor in my breast. He sent me for a mammogram, but the mammogram didn't pick it up because it was sitting in my chest wall. We had the surgery. No, he asked me to watch it because it was 2 days after my menstruation. So he says, let's wait a month after your next menstrual cycle, and then we will check it again. When he measured it first, it was 2 centimeters by. I honestly don't know what the by is. I can't remember. And then when he checked it a month after, it was now 5. So immediately he said, we have to do something. He referred me to a surgeon, and the surgeon decided it is growing too fast, so they're going to take out, do a full lumpectomy. And they also took out 2 nodes. When I came to from the surgery, I asked them to see what came out of me. The nurse was hesitant, and trying to persuade me not to look at it. And I said, no, I want to see it. So after seeing what came out of me, I realized something was wrong. So they told me it would take about 3 weeks for the results to come back. When I went for my post-op now, the same day I went for my post-op, the results came in. And so I was mentally prepared for the results because of what I saw. So when he said that it was cancerous, it wasn't a shock to me because I had already mentally prepared myself, but I didn't tell anybody about what I saw. So I had already prepared myself. And my husband was there with me after speaking with us and asking if there's any question. He was like, he wanted to leave. And I continued asking questions and so forth. I went in for my examination and he was like, Lynette, you're acting normal. I said, what else can I do? I can't do anything, but I just have to now prepare myself for what is to come. And as soon as I left and went outside, I looked up and I said, thank you, Lord. And my husband looked at me like if I was crazy. And I said to him, it's only 2 things. As I said before, it's either I'm going to die or I'm going to work for the Lord. And that has taken me through. That has been my strength.
All right. Thank you so much, Lynette, for sharing such an inspirational story. We have Dr. Serena St. Luce back with us. Just to give you a little insight information, our Nagico agents are experiencing a little technical issues, and as soon as that is rectified, we will have them on the discussion. Dr. St. Luce, tell us a little bit about yourself. You're new to our program. We've had different medical practitioners from Celeste Bird Medical Center and throughout the Caribbean. Who is Dr. Serena St. Luce?
Um, I don't know. I don't know if you can hear me. There's a lot of static on the line. But
Yes, we're
basically,
hearing you
can you just
clearly.
let me? Okay, because I'm not hearing you guys very clearly at all. Okay, so basically, I'm one of the 5 general surgeons that work at the Celeste Bird Mount St. John's Medical Center. I've been there since I think it's October of 2013. Um, I don't know what else to say. I mean, my background is I'm a UWI graduate. I did surgery in New York at Brooklyn Hospital and New York Presbyterian. I also have a fellowship in minimally invasive or laparoscopic surgery that I did at New York Medical College. I don't know what else there is to say. I mean, my background is in microbiology and immunology, and that's basically.
All right, so we're going to delve a little bit into cancer. So you're a general surgeon. What are some of the type of cancers you have operated on as a general surgeon?
Okay, so basically, it would be the top, I guess, 5 would be in women. It would be breast cancer, stomach cancer, and colon cancer. You know, those are and then in men, the same colon and stomach. Basically, those are the the male and female cancers that I've operated on. But we have there are other unusual cancers, but those are probably the most common cancers that I think all of us operate on here.
All right. So, at what stage will a cancer patient see you? I know there are different persons, there's a chain of persons that you're required to see. Let's say, for example, it's a gynecological cancer, they may need to see their gynecologist. At what stage would the surgeon come in to the equation?
Okay, well, let's say breast cancer, since October is breast cancer month. But usually, what happens is, people are usually referred in to the Celeste Bird Medical Center, since it's the single tertiary care institution, public tertiary care institution on the island. So they would be referred in usually by their primary care physician, who can be a general practitioner, a district medical doctor, sometimes for investigation of, in the case of breast, it would be a lump in the breast or any kind of breast complaint. It doesn't have to be a lump. It can be pain. It can be a nipple discharge, just an unusual feeling in the breast. In the case of colon cancer, I mean, a lot of people are referred in because they have blood in the stool and they're sent for a colonoscopy, at which point sometimes the colon cancer can be diagnosed. And a lot of people, well, what we tend to see most frequently at the hospital is a lot of people present with pretty late stage colon cancer. So they present either with passing blood in the stool or obstructed, completely obstructed, meaning the intestines are blocked by the cancer. In gastric cancer or stomach cancer, again, some people have pain, some people have they vomit blood. There's so many different symptoms, but usually they're referred in either by a primary care physician, a district medical doctor, or quite frequently they, in the case of gastric cancer and colon cancer, they may show up in the emergency room because of, some acute event, bleeding or usually obstruction classically.
All right. Thank you so much, Dr. St. Luce. Again, for those of you who are joining us via our social media platforms, remember you can leave a comment in the comment section for any of our panelists. They'll be more than happy to respond or answer your questions. So, Lonette, I'm going to go back to you because many of our previous cancer survivors have spoken about the different coping mechanisms they've used to help them to cope with the treatment that they had to undergo. What sort of coping mechanisms did you have to use during that process? Your mic is muted. Remember to unmute your mic.
Yes, sorry about that. For chemo, I was on the cocktail TCH, which is Taxotere, Carbotin, and Herceptin, because I was triple positive. My estrogen, progesterone, and the HER2 were positive. Because I didn't see an oncologist immediately, because at the time the oncologist was not on island and we waited for a while and then I was referred out. the oncologist that I went to said to me that she's going to put me on a strong chemo regimen because she is coming in at the end. Because for her, she would have preferred before the lumpectomy that we would have shrunk the tumor before all the surgeries. So uh, for me, mechanism wise, I read a lot, prepared myself for what is to come, and I prayed. My strength came from prayer, and that was what, because when I read the side effects, especially for the first one, Taxotere, one of the side effects in one of the read-ups that I did was death. So it was a matter of prayer. And person said, are you going to take it? Because there were friends who were trying to persuade me to go the natural way. And my thing was, God gives wisdom to the doctors and the scientists. So I will do both. I'm going to take the chemo, and then on the side, I will go the natural way in how I eat and, our local bush tea, different things. But I was going to do both because he gave them wisdom. And we have to put our trust in him. And if I ask for help, and that's the help he's sending. So my mechanism was, for me, for coping, was prayer. And then as I eventually all the support that I got from friends, family, work, the social groups that I'm in.
All right. Thank you so much, Lornette. And we have the ladies from Nagico Insurance Anguilla with us. And we just want to thank you for sponsoring the show. We have Miss Sandra Brooks and Imogene Taylor, both from the medical unit at Nagico Insurance. Imogene, tell us a little bit about Nagico Insurance. What are some of the services that are offered by your insurance company?
Good afternoon, good evening, ladies. And I must say, your stories are very encouraging from the doctor and to the survivor. I lost my mother a few years ago to breast cancer, so it's always very nice to participate in sessions like this. I am Sandra, and I'm sitting alongside my supervisor, Mrs. Imogene Taylor, but we're going to do it in two halves. So when I'm tired, she'll take over. Good evening again. Welcome from Nagico Anguilla. Just a little briefing. I'm sure you all know when you've heard of Nagico. Nagico operates in 21 territories in the Caribbean, as far north as the Bahamas to as far south to the ABC Islands, Dutch, English, and French. Nagico has been in operation since 1982 and prides itself on offering great, reliable service to all our customers. We in Nagico Anguilla, we are the branch office, and we are responsible for the English-speaking islands. We have many of the various types of policies that we can offer. We offer group coverage and we offer individual medical coverage. We have gold packages, EC Gold and US Gold packages. The EC Gold package has a lifetime benefit of up to 1 million EC. The US Gold package has a lifetime benefit of up to 1 million US dollars gold lifetime coverage. Turquoise is 250,000 lifetime coverage. All the policies offer several riders: medical, dental, and vision.
All right.
Medical
Thank you so much. That medical, dental, and vision. We're going to get back to you with some more information regarding the policies that you offer, but we're going to switch back over to Dr. Serena St. Luce. Dr. St. Luce, we are highlighting breast cancer in the month of October, and 10 out of 12 months, different cancers are highlighted. Last month, we would have looked at prostate and childhood cancers. Now, breast cancer. We often hear about lumpectomy and mastectomy. What is the difference between both of them?
Okay, I just caught the last part of your question. What is the difference between lumpectomy and what's the other?
Mastectomy.
Mastectomy, you say?
Mastec. Mastectomy.
To me and lumpectomy. Okay.
Yeah.
Yeah, because I'm not hearing you very clearly. I know why there's a lot of static on this line. Okay, so what's
Okay.
the difference between mastectomy and lumpectomy? So generally, modified radical mastectomy is one type of mastectomy. You also have a simple mastectomy or total mastectomy, which is, so there are different types of mastectomies, but in general, mastectomy means removal of all breast tissue, right? And also the entire breast is removed, and that includes the nipple, the areola, and all breast tissue is removed, completing behind the pectoral, which is the muscle behind the breast. Okay. Now, in a modified radical, you would also automatically take your gland in under the armpit along with the breast. And that's in cases of breast cancer, because one thing that's important is important how we stage breast is dependent on the size of the actual tumor in the breast. So you either remove the lump, as in a lumpectomy, or the entire breast, but the pathologist will tell you the size of the tumor. We must know is whether the lymph nodes or glands under the armpit are also positive or, you know, have cancer in them as well. So that's very important to know in cases of breast cancer. Now, a simple or total mastectomy, you breast and no lymph nodes. That's classically not done for invasive cancer. So once you have there, the typical invasive cancer, you'd remove, breast as well as lymph nodes, or you'd remove the lump, which is what a lumpectomy is, and lymph nodes. But part of the stage lymph nodes. So whether you remove entire breast and within that you find the lump and you determine what size the lump is, or you remove just the lump alone along with lymph nodes. Right. Now, a mastectomy where you don't remove lymph nodes ever is usually not done for invasive cancer. Invasive cancer, we need to know what the status of the nodes is. And the difference between the two usually is when you do a lumpectomy only, you must get radiation to the rest of the breast. Okay, because a lumpectomy alone does not offer you local control. So just removing the lump alone is inadequate, right? You have to do radiation to the remaining breast tissue in order for it to be considered a complete treatment for that, as in terms of the lump in the breast or the local cancer, right? So it's lumpectomy, remove the lump with radiation. Mastectomy is usually you remove the entire breast, along with, in case of a modified radical, with lymph nodes, or a simple mastectomy without lymph nodes.
All right. Thank you so much, Dr. St. Louis. Lynette, you would have undergone radiation or chemo treatment after you were diagnosed with cancer. What were some of the side effects you experienced?
Okay. Because of what Dr. St. Louis said, I also need to say that after my first surgery with the lumpectomy and taking out the 2 nodes, I then had a full mastectomy, and they also took out some more nodes, I think about 13, and out of the 13, 11 were positive. So I had a full mastectomy also. Some of the side effects that for the chemo, I lost all my hair. My hair started a day after the first chemo treatment. I started to lose my hair. By the end of the week, my hair was gone. My nails became brittly and green. After each chemo cycle, my hands and my feet peeled. My muscles became very weak. It was a strain to walk. And I started having breathing issues. I also had vaginal sores. My first chemo experience, on the 5 minutes, I nearly died. It was, for me, it's as if all my organs started to were forcing themselves up to come through my mouth, and my eyes, like if they wanted to pop out my socket. The doctor said they have never seen a reaction like that before. They had to just put IV fluid through me for an hour and a half, and then moderately continue that chemo medication, which was the taxane. And then I had to go back the next day to continue the other part of the chemo. And as we progressed, because it was so potent, it took a while to really get it down to what I could really stomach. And by the fourth, we had it down. It was 6 cycles I had to take. And a lot of persons asked me, "You're going back?" I said, "Others have taken it. Others have taken it, and I've gone through, and the doctor is there with me. It's not that I'm taking it on my own. I am being monitored as I go through, and things happen. Everybody's reaction to medication is not the same." Those were some of the major side effects that I had with the chemo. With the radiation, towards the end, I was burnt. I had burns. My skin became cracked and burnt. But prior to that, I had no side effects to the radiation. Actually, to me, it gave me energy. I was up and about and bumped around. The doctors were, again, amazed because they said for some people it makes them drowsy, but not at all. I didn't lose my appetite. I ate as like nothing. Actually, I gained weight with chemo. My sense of taste, nothing went for me. So I didn't have those side effects. Oh, what happened though? I had to change my toothpaste. My mouth became very sensitive. I had to change my soap. A lot of things, the regular soaps were drying out, so I ended up using Dove Sensitive because everything I tried dried my skin. And for toothpaste, it blistered my mouth. So I ended up, eventually I started on baking soda toothpaste. That was until after chemo. That's what I had to use. The only thing that would work for me.
All right. Thank you so much, Lornette. We're going to go back to Emma Jean Taylor from Nagico Insurance, Anguilla. Emma Jean, at what age would you recommend persons to begin signing up for a medical plan?
We usually recommend persons to sign up as early as possible, and that can go from the age of 18.
All right. Just a few comments coming in from our Facebook Live. We have a comment from Lily Fagan. She's saying, "Good evening, everyone." Good evening, Lily from Antigua. We have Bernadette Joseph Ephraim. Good night to everyone. And we also have a comment from Unetta Bird. She is the president of Breast Friends Antigua. And she's saying, "I would like to encourage Lornette to continue to share your story. You are helping so many women to be aware of their breast health. Breast Friends salutes you." Good evening, Unetta Bird. Now, Miss Brooks, you have been in the insurance industry for quite some time, and you would have mentioned the importance of signing up at an early age. Can you explain some of the benefits of signing up for an insurance policy, a medical insurance policy at an early age? What are some of the specific things that this policy offers that would warrant persons to start that investment early?
Insurance, especially at this time, with all the circumstances and everything, as we speak about breast cancer, I think it offers you a peace of mind. Having insurance, if you are familiar with your package and what your package entails, it should really give you a peace of mind and cause you no issues, and also give you security. Benefit packages we have different benefit packages per policy type. As I had said previously, we have EC and US Gold policies, EC and US Emerald policies, and turquoise policies. Each policy has its policy terms and conditions. There are different co-insurances. You can have a 20% co-insurance or a 30% co-insurance. We cover almost everything, we should say. We have to be very careful what we say, but everything goes to what according to your policy terms and conditions. Benefits of the policies, most policies include organ transplant, air ambulance, physiotherapy, diagnostic expenses, specialist visits. There's also a preventative care, which is an annual benefit, which we encourage everyone, both female and male clients, to take advantage of. Which preventative can include your screenings, your mammograms, all your health screenings, your profile screenings, which obviously in this day and age is usually the first detection is usually done with those screenings. So every policy has that benefit assigned to it. So we do encourage everybody, whether you're 18, 40, 50, 55, and you don't have insurance right now at this time, to consider it.
You mentioned the age 55. How likely it is for a 55-year-old to be accepted at Nagico if they were to sign up for policy, a health policy, a health
Every,
plan at 55?
every application received is underwritten. So there's a process of applications that you have to complete. You have to undergo the part 2 of a medical application, which is conducted by a local physician. The application is then returned to us and it is underwritten. We submit it to the underwriters, who usually return it within 3 to 5 working days with their underwriting decision. The underwriters can and may exclude conditions which are presented on the application. And it's very straightforward. If you're 55, you are still eligible. If you're 60, you're still eligible. You may be eligible for coverage, should I say. But everything is based on the application submitted, and the final decision is with the underwriters.
All right, thank you so much, Miss Brooks. I just want to read a few comments coming in from those persons that are joining us via Facebook. We have a comment from Francine James. She is one of the directors of Community Charitable Ministry, and she's saying a positive mindset and trust in God bring about positive results. To God be the glory, Miss Belle James Knight. We also have a comment from Unetta Bird. She's saying, good evening to the host and all the members of the panel. Good evening, Mrs. Bird. Now, Dr. St. Louis, we're going to go back to you. What are some of the risk factors that could cause breast cancer?
Sorry, I didn't hear that.
What are some of the risk factors that can cause breast cancer?
Did you ask what are some of the factors that
Risk-
can cause breast cancer?
Yes, risk factors.
Oh, okay. I don't know. Yeah, because I'm barely making out what you're all saying, but okay. So the factors say cause breast cancer, but what we look for when you basically come to a surgeon, for example, you're referred in by your district medical doctor, you have nipple discharge, you have something unusual that you're not comfortable with. What we do is we take a that seeks to determine risk factors for breast cancer. So we get to the stage of doing a biopsy, risk that this complaint, this lump, this nipple discharge could be cancer. Probably the biggest one, age. The older you are, the more likely you are to develop cancer. That goes for all cancers. The older you are, the more likely you are to have been exposed to environmental factors that eventually can lead to the development of cancer. Everybody's probably aware of the BRCA1 and BRCA2. Just been a term that's been in the media a lot in the last couple of years. So if you possess one of these hereditary breast cancer genes, BRCA and BRCA2 are just two examples of, there's several others. That's one. So hereditary factor, you can't avoid that. Another factor is diet. So lately they found high fat diets, and obesity contributes to breast cancer. Tradition, another big one is age. Women who have early menarche, meaning they start having menstrual periods very early, 8, 9, 10, and menopause very late, like in their 50s, which means the longer of the period they would have been exposed to estrogen, which is one of the causative factors that has been found in most breast cancers. You know, it is an that can lead to breast cancer, just exposure to estrogen. Not having any children, having children at a later age than, you know, rather than younger age. So, you know, if you have one child and that child's at age 30 something, for example, or no children at all, is basically increase your risk simply because have been exposed to the hormone estrogen for a much longer period of time, because usually your estrogen levels are much lower. Progesterone tends to be the pregnancy hormone. So, you know, estrogen during that 9-month period of pregnancy. Breastfeeding, if you breastfeed your is that reduces your risk of breast cancer, right? So that's one of the factors that actually reduces your risk. Exposure to radiation. If you work, for example, in you know, for example, you know, if you work somewhere where you got regular radiation exposure, you know, direct radiation exposure, you know, certain laboratories, if you did research in a lab where they use a lot of radioactive material, or for example, if you had lymphoma and you actually got radiation treatment for another cancer, such as Hodgkin's lymphoma, that increases your risk of having breast cancer. And, you know, I guess hormonal contraceptives containing estrogen, you know, by the same token, also basically exposes you to the increased risk of breast cancer. So you know, hormonal contraceptives, the longer you've been on hormonal contraceptives with estrogen in them, especially hormonal contraceptives with high doses of estrogen. And for example, another example of a preparation that has high doses of estrogen, but we don't use this anymore, hormone replacement therapy, which traditionally in the past used to be given to postmenopausal women to mitigate the symptoms of menopause, but we don't very for breast cancer. So we're practice just routine prescription of replacement hormones after menopause. So those are basically just some of the risk factors, but you know, no one factor alone will cause you to have breast cancer, because patients have just very few or sometimes none of these risk factors at all, but they all contribute to, you know, your potential risk for developing breast cancer.
All right. Thank you so much, Dr. St. Luce. Good evening, Mr. Joseph. Thank you for tuning in. Again, those of you who are joining us via any of our social media platforms, that could be Twitter, YouTube, or Facebook, remember to share the live. Remember to leave your comments in our comment section. Our panelists will be more than happy to answer your questions. Back over to you, ladies from Nagico Insurance Anguilla. Apart from cancer, what are some of the other terminal illnesses that are covered on the Nagico Insurance medical plan?
Most terminal illnesses are covered once a person is eligible for such, and we have prostate, we have a number of terminal illnesses that are usually covered.
All right, thank you so much. Lonette, we're going to head back to you. Now, I would like to think, oftentimes when persons think about cancer survivors, they think about the survivors. But you mentioned that you were a source of support to your family. Did you receive any counseling as you went through this process, or did your family undergo any counseling while you were undergoing the treatment?
No. I must admit that. No, I didn't receive, and they didn't receive either. So
But
it
is there
was
any
just
particular reason why you didn't
you
request
didn't
counseling?
you didn't think about it. I honestly didn't think about it at the time. At the time, I didn't. Everything was happening so fast. I was diagnosed in August, had my first surgery. No, I had my first surgery in August, got my results in August, the end of August, had my second surgery except the beginning of September. Then I had another surgery to put in my port at the end of September. So everything was happening. Then I should have had started chemo in October, but then I had to have another surgery. But this one was dental to remove all of my wisdom teeth all at one time because I was having some problems, and my oncologist, two surgeons, and dentists had a conference on me, and they all decided that let's take them out now because if during chemo you can't have any form of surgery. So they said to eliminate any possibility, they took all four one time. And then in
Wow.
December, I started chemo. So everything it was just fast track from the lumpectomy to the mastectomy to it was just so the thought of counseling at that time didn't come into play for me. And
All right.
it was not offered. If somebody didn't say, well, why don't you? No, it wasn't at that time.
What about physical therapy? What was that experience like?
Well, only physical therapy I've had because I developed lymphedema in my arm. I had for that. Even though I still do therapy because heat makes my hands swell up. So, but I remember at one point there was a 2 week span where my therapist was he said, just like my doctors, I sent him back to the books because he thought he was doing something wrong because there was no movement. There was just no movement at all. But I can say now, if I follow the diet, there's a diet because certain things they've asked me to stay away from for lymphedema, like dairy products, because what they have said to me, there in dairy, there's an enzyme that helps us produce fluid. So they asked me to stay away from that because that's extra fluid. So try some other, other means of calcium and so forth. So I use coconut milk now. Other persons have recommended almond and so forth. So that my diet has to change also, not only for the cancer, but also for my lymphedema.
All right. I just want to say good evening to Shanice McDowell. Thank you for tuning in. Good evening, everyone. I'm enjoying this evening's discussion. Remember, for those of you who are joining us via any of our social media handles, remember to share the live. And remember, you can ask any question to our panel. They'll be more than happy to respond to your questions. Now, back to the ladies at Najiko Insurances. Now, I mean, we've heard the story of Lynette James Bell Knight, Bell James Knight, very long name. All right, so Lynette has a Najiko insurance and she's unable to get her treatment in Antigua. And let's say there's an oncologist or radiologist in Anguilla or St. Martin. Will she be able to travel to any of the countries in order to get her treatment using her insurance coverage from Nagico?
By all means, yes.
All right. And is she limited to any, is she restricted to specific islands, or can she go to any island that has a Nagico branch? How does that work?
By all means, persons can select a provider of their choice. However, Nagico do have all network providers that we would recommend, and it is up to the client to decide whether or not they so wish to remain under our network providers.
And tell me, what makes Nagico insurance unique, different from the other insurances? Because some persons may say, okay, why should I choose Nagico over another insurance? What about your product is so unique that would appeal to persons?
Longevity. There's several factors. One of them is the longevity of the company, our expansion, and we do have a motto. Our motto is fast, fair, and always there, which relates to the processing of many of our claims, not just our medical claims, but our motor and any other claims that may be submitted, that we are fast when processing. I don't want to hear any comments, but that is what we stand for, fast, fair, and that we're always there. And we will remain there. So I think that's what everybody should come back to us, come to Nagico and see our friendly faces and ask us about what we offer so that you know what we have on offer.
All right, thank you so much. Dr. St. Luce, I'm gonna switch back over to you. And one of the
Hi,
things
I'm
I
actually
always
trying to.
want,
Just try.
Sorry, I'm
are you
moving around
hearing?
trying to. Good. Hi.
Okay, we're hearing you clearly, Doc. Dr. St. Luce, I've always wondered, is there any particular reason why it is recommended, why women are why older women over 40 are required to take the mammogram as opposed to younger women?
Why woman over 40? I didn't hear that. Sorry. I'm trying
What
to.
for the examination of the breast, when you're assessing the breast, when you're doing your screening, why is it recommended that
Well,
women over 40 do the mammogram as opposed to persons under 40?
okay. Okay. Screening recommendations. So, the screening recommendations for breast cancer vary actually greatly. I don't know if you can hear me. I'm back.
Yeah, we're hearing you
Depending
clearly.
on anti. So, can you hear me?
Yes,
Okay.
we're
So in
hearing you. Go ahead.
Antigua, okay. So in Antigua, the recommendations we follow is the screening mammogram starts at age 40, but the breast exam, basically doesn't routinely start at any particular age. It's just that our routine screening starts at age 40 in terms of the mammogram, along with the breast exam. But anyone who has a complaint, pain, lump, at any age, whether that is 16 years old or 26, undergo exam as well as an ultrasound or some sort of imaging if indicated, right? But the screen that you start mammograms at age 40. In some places, even in the United States, some states start at 50. They've shifted. Europe, most screening at 50 or 55, and they do the mammogram every 2 years. But in Antigua, we tend to stick to starting age 40 mammogram annual, or on what your doctor recommends, risk stratification. But it varies, the screen recommendations, because you have to bear in mind the people we screen. So screening is different from just routine examination. So if somebody 20 years old comes in and says, I have a lump in my breast, you're going to examine that person. You're going to send them probably for an ultrasound, not a mammogram necessarily. And the reason we try not to do mammograms on younger women, because younger women who are still, their breast is still subject to the influence of hormones. So women in their childbearing age tend to have denser breast tissue, right? So there's more breast tissue, which white on a mammogram, very helpful. So breast tissue does image well in terms of the mammogram. You're not going to see small distortions in breast architecture on a mammogram. So women are old menopause, and the breast starts to the breast tissue, there's less breast tissue. The breast tissue starts to, basically go away and be replaced by fat. Now, fat, is easily imaged X-rays. X-rays pass readily through and give you a nice image. So if there's any architectural distortion or, any calcifications, which are, features that radiologists look for via cancer. Those are more easily seen in older whites. When you look at a mammogram, it's going to be very hard for you to distinguish. And in fact, interestingly enough,
I
increases
think
your age, because more cancers are diagnosed in older women than in younger women. And the idea about screening is you don't want to send people in their 20s or 30s for mammogram and breast exam, because there are not that many people who are going to develop breast cancer in their 20s and 30s. So you want to target the age group where cancer is more likely to occur. And in general, that's thought to be over 40, or even more so over 50. So the mammogram and breast exam screening protocol is targeting the highest risk group. But that, but we just don't screen them on a routine basis. They basically would be evaluated on a case-by-case basis. So if they, they feel alarm, they're concerned thing, then that person gets specifically an exam and imaging targeted, usually an ultrasound in a younger woman, to evaluate whatever they're concerned. Though we don't start doing routine screening breast exams on women under 40, generally women are encouraged to be familiar, right, which involves basically examining your own breast periodically. You shouldn't wait until, out of the blue, something, you feel a lump. You should be familiar with the way your breast look, how the nipple looks. If one day the nipple, which used to be out, is suddenly invert, if suddenly you see a dimple on your breast that wasn't there before, pain that you can't explain, before your breasts were pretty much, equal on both sides, and suddenly you look in the mirror and you realize one looks a lot smaller than the other. Those are things that, women of every age are encouraged to be, familiar and aware of your own breast. But in terms of screening, no, we start at a later age, 40 or 50, depending on where you live, because that is the age group, over 40, over 50. That's it. And it goes on ad infinitum, because just the other day I had a patient who told me, well, she was told that she's 70 now, she doesn't have to go for annual gynecological exam, and she doesn't have to do mammograms anymore. That's not true at all, because the older you are, cancer. So, you should continue screening, really, basically to the end, because the older you get is the more you're exposed to all the risk factors. And, cancers tend to happen in people, who are older. So, screening continues. There's no age where you stop screening for of that. A cutoff is in prostate cancer. So in prostate cancer, we don't screen men over 75. I believe it's 75, simply because in a man 75 newly diagnosed with prostate cancer is slow growing, it's indolent, and the thought process behind that is, if you get diagnosed for the first time at 75 with prostate, not likely to kill you at that age. It's usually a pretty indolent, slow growing, cancer at that age. It's a lot different if you're diagnosed with prostate cancer in your 40s, however. But usually, routine screening, that is, for prostate cancer, usually ends at about 70 or 75, I think, is a recommendation. But for women and breast cancer, no, you continue screening, to the extremes of life.
And another question, how do you determine at what stage a person's cancer diagnosis is? How do you determine whether it's stage 1, 2, 3, or 4? Who determines that, and how do you go about deciding that?
How do you determine, sorry?
The stage the stage of someone's cancer, whether it's a 1, a 2, a 3, or 4.
You mean how to diagnose a cancer?
Yeah, how does the medical practitioner go about determining at what stage a person is of cancer, what stage cancer the person has? Whether they are at stage 1, stage 2, stage 3, how do you determine that?
Okay, I'm going to repeat. Really, there's, I'm really not hearing very well. Okay, how do you determine what stage the cancer is? That was the question, right?
Yes, affirm.
Okay. Well, in terms of breast cancer, so the first thing, and in fact, this is true for any cancer. So the only person who can give you that diagnosis and tell is ultimately the pathologist, right? So you need tissue. You have to have a biopsy. I mean, there are lots of things that look like cancer to the naked eye, or they look like cancer on a CT scan. But ultimately, the person who gives you that definitive diagnosis is a pathologist. And in order for the pathologist to diagnose you, you need tissue, you need a biopsy of some sort. And there are different ways that biopsies cancer. In the old days, we used to just take out the whole lump, right? That has shifted somewhat, right? Simply because now, and this is started training. What happens now is you do the least invasive biopsy possible. So ideally, the kind of biopsy that we tend to go for first would be what's called a true cut needle or core needle biopsy. So for lumps that you can feel or abnormalities that you can easily feel, that the surgeon can feel, we tend to use a called a core or true cut, and you basically take pieces of the lump and send that for pathology. If you can't do that for some reason that are too small to be felt, on examination, you might need to go for what's called a stereotactic biopsy, which is done with mammogram guidance. So some people, and the people diagnosed with very early stage breast cancer are people who don't feel a lump. They basically go for routine screening. Hence the reason that we do screening is because we pick up breast cancer after there's no lump. It's a small abnormality on a mammogram, just a simple tissue distortion. There's no, you can't feel any lump. Mammogram, you guided mammogram really use needle, see that small area guided by the mammogram. There's also ultrasound guided biopsy. So again, you can't actually, there's too small to feel, but they're detected on ultrasound. You can use ultrasound to do what's called put a needle in it to actually biopsy, or you put a needle to mark the spot, and then you go to the operating room and remove the whole lump using needles, which are marking this lump, which you can't really feel. There's also an biopsy where lump that you can feel, but it's large. You take a little piece of it with, in the operating room. And then you have, and, as, has been referred to earlier, can be a way of biopsying. So for relatively small lumps, instead of taking little pieces of it, you can tear a lump out. But the whole idea is to do the quickest, the most biopsy possible. So if biopsy of it, you can't feel it, you can again use needle guided by ultrasound or mammogram to room and remove the lump. So there are different biopsies. So once you do the biopsy and you send tissue to the lab, the pathologist is going to look at that tissue under the microscope, and that's all what determines whether it's cancer or not. It's the pathologist. There's that pathologists look for under the microscope that are cancerous. Once you know that it's cancer, the next thing to determine, yeah.
All right. Oh, go ahead. The next thing to determine.
Yeah, the next thing is this lump. So staging involves, there are 3 components staging, right? So once you know it's cancer, that's the first thing. The next step to determine what your treatment is. So staging involves, right, which we ultimately only know removed or the breast has been removed, to whether or not. So is there any cancer earlier, once it's determined to be an invasive cancer, we're going to sample and see if there's cancer in those lymph nodes.
All right, thank you
And
so
then
much.
the third component is, has the cancer spread to any other site distant from the breast? So has the cancer spread to the common places that breast cancer tend to spread to? Lungs, to the bone, to the liver, scan, right? And that would be done by oncologists. Usually they'll send you for a CT scan of your chest, abdomen, and pelvis to determine if you have metastatic lesions or basic breast cancer that has either your chest, your abdomen, or your pelvis. And that's basically it. And then, you know, there's also, someone asked me this question before, PET CT, a regular CT, sensitive type of CT scan, where you combine two imaging modalities, the PET sensitivity for picking up metastatic deposits, but we don't have that CT in Antigua, we just have regular CT. So once you have your tumor size, whether you have positive lymph nodes or not, and whether you have metastases, like cancer, to other parts of the body, then you can determine, based on a combination of those three components, you determine what stage, and it can be stage 1 to 4. Stage 1 usually involves no lymph nodes at all. Stage 4 would be spread of the cancer to other parts of the body. And then 2 and 3 are somewhere in between.
All right, thank you so much, Dr. St. Louis, for such an insightful response. We have a few questions coming in for you, but we're going to switch over to the ladies at Nagico Insurance in Anguilla. Now, what are some of the group plans do you have available for companies, and why would you recommend organizations to sign up for one of your group plans?
Medical insurance is paramount. It provides a peace of mind and security to the client, family members, and employers. We encourage employers and individuals to secure and ensure that all employees and all candidates invest in health insurance. It's also a very good benefit at this time. Reason being, we have recognized that various providers require members seeking medical care to be financially secured with health coverage. It also affords members the peace of mind and opportunity to get early screening care under the preventative coverage, which can detect early medical issues.
All right, thank you so much. And what is the process like in signing up for an insurance policy?
As said, you can come and you can discuss. It's the completion of the application form, the medical form, which is to be completed by a local physician, submitted with photocopies of IDs, and we actually have to have all applications are underwritten between a 3 to 5 day period. The final decision on the application is by the underwriters. The application can then be approved or denied, depending on what is depicted on the application. But the final decision is with the underwriter.
So, based on your experience, what are some of the reasons why an underwriter would deny an applicant?
Usually, application can be denied based on, say, for instance, a person having a terminal illness, or the BMI is extremely high. And we must bear in mind that, once a person has a terminal illness prior to enrollment, to access the mortality risk of that, we are unable to be able to provide a health rate for such instances at times, and that's mainly when it relates to individual policies and relative to the group policies.
And what if somebody in their early teens, like, sorry, a 19-year-old has a high BMI, will that person be approved even though that person is young?
Usually, again, there are exceptions. The underwriter will review that. Most of the times, once a person have a high BMI, it is usually denied, and that is due to health issues later down or along the line of their aging time.
So would you recommend, like, let's say, for example, somebody's trying to sign up for a medical or a life insurance and they're overweight, would you recommend them to reduce their BMI or lose the weight before they can apply for their insurance?
I will encourage persons to do such.
Okay, awesome, awesome, awesome. And where can persons find additional information about your services? Because there might be persons in other countries or in Anguilla that might be interested in finding out about Nagico. I notice you have a wide variety of services apart from medical. You have the life insurance, the general insurance. Where can they find information? And can persons sign up for a plan online, or they are required to come into a Nagico office to sign up for a plan?
You can visit our website, www.nagico.com, where all the information is available. You can also access it per territory. You can submit a medical quotation, a request for a medical quotation. You can, if you are a client, you can upload your medical claim form. And all the information is there. You can also contact our office. We're located Albert Lake Drive, the Valley, Anguilla, and our telephone number is 1-264-497-5940.
All right. And are you required to do a physical examination before you can be approved?
The physical examination is part of the application, so you will be required to complete the physical. It's not a physical per se, but it is an application that must be completed by a local physician. It just basically asks you questions, which we always encourage all applicants to disclose all past histories on their application. So that has to be part of it, but it must be completed and signed and stamped by a local physician.
And so it's any local physician. It's not one assigned by Nagico.
Any local recognized physician.
Okay, no problem. All right, thank you, ladies.
Can I just add one thing? We spoke about the age. Premium is dependent on age. So we would encourage you to sign up the younger you are, because the premium is on your age. So when it's more reasonable. So an 18-year-old premium is not going to be the same as a 35-year-old premium, which is also, and they're EC and US, so it's what you can afford. So that's another benefit, because it's most probably cheaper than your telephone bill, your monthly telephone bill. And
all right.
Right now.
And what if a person skips a payment? Let's say, for example, I missed a payment. Will I be kicked out of the policy? Will I lose that policy? Will I have to start over again? What happens in a situation like that?
Relative to missing of premiums, usually we would advise persons if they are having difficulties regarding payments to advise us. However, you must take note that we would not be able to extend coverage if premiums are not up to date. If it goes beyond a certain period of about 60 days, that policy can be flagged for cancellation, and the person would have to reapply if they so desire to have that policy again or a policy again.
Okay, you mentioned about the underwriter evaluating, well, doing an assessment of the application. How long does that process take in total from the time I would have submitted the application until the time I'm approved? And at what point can I begin to claim on the insurance?
My colleague would have mentioned that it takes about 3 to 5 days in regards
Okay.
to getting a response back relative to requesting coverage. Our policies does afford members to claim immediately. However, there are deductibles that must be satisfied first. And once that deductible is satisfied, then by all means, that member is once they are eligible, they can move forward in claiming. And our deductibles are like $200, 200 EC, some are 200 US.
All right. Thank you so much, ladies. I'm going to go back to Lonette before I ask Dr. St. Luce a question from one of our Facebook viewers. Lonette, apart from your family, what other support system was in place for you?
Well, I can say the church. I'm very active in my church, the cathedral, St. John's Cathedral, and they were very supportive. I'm also a member of the Girl Guides Association, and I can tell you they were here for me and they're still here. I'm a member of a group called the DOKWA. I'm the youngest member. The average age is 70. And when it came to motivation and so forth, these seniors were really there for me and put themselves out to support me. My work, extremely supportive. After my first dose of chemo, I couldn't, even the wraps that they have for cancer patient was not protective enough for me. So I work in a bank, and see me in a bank in a TAM. They allowed me to come into the bank in a TAM. I worked when I could, and when I couldn't, I was home. I basically worked half a day when I went in. Even now, they're still supportive, because as soon as Antigua had this second case of COVID, they sent me home, and that was March last year, and I'm still working from home. In December 2014 was my last menstruation until December last year. When it came back last year, it came back for 12 days, very heavy. On the 9th day, luckily, God is so good, right? It was a Friday, and I'm home. And about 1 o'clock, I felt like I was going to pass out. So I called my manager, and I report my manager's in Barbados, and said to her, I'm going to if you can't get in contact with me, I'm going to lie down for about an hour or two. And I explained what was happening. And she said, come off the system. I said, yes, I'm going to come off. But she said, come off the system. I said, okay, I'm just finishing up something. I'll come off. She checked back about 2:30, and I was still on. She called the director, and he came on and said, if you're not off by 3 o'clock, we're going to lock you out of the system. So they are there for me. It's not just they look out for me, and it's not just in Antigua. The support has been extremely with COVID. I registered for the first day of registration, and was waiting for response for my appointment. I didn't get any, and when it was coming up near the end for the first set of first dose to be administered, I still haven't gotten a response. And the thing is, why I didn't go in the rush, one, COVID, and then you had to be out in the sun, and my hands was the problem. The bank called me, and I'm home, to find out, if I'm going to get vaccinated. And when I explained to them, in no time, they arranged for me to get the vaccination. So they have been very supportive and been there with me.
All right. And what advice would you like to give other employers who might have employees that have been diagnosed with cancer but just don't know what to do, how to help them to go through that process?
Be empathetic. Listen. You have to listen to that individual, and you can't gear it on somebody else who have had cancer before, because each of us go through something different. It affects us all differently. The side effects, uh, how we approach it, it's different. So you have to listen to that employee. You have you have to also, for a time frame, see how their work life and their home life is, the workload at that point in time, and how best you can make it comfortable for that person to gain their momentum back into the system. Because I suffered from chemo brain, and I'm still suffering from chemo brains, but it has gotten better. But at first I didn't know what was happening, and at times too, persons would say to me, "But you should know that," and
Yeah.
it was a bit embarrassing. So it's for persons to be more aware. When you have a staff, I think the management who need to educate themselves so that they can assist the employees in functioning within the workspace.
Thank you so much, Lonette, and the fellow Toastmaster, Lonette. We have a few questions for Dr. St. Luce. We have a question from one of our Facebook viewers. I would like to know of there is if there is such a thing as overexposure to radiation by doing too many mammograms. That's a very good question.
Okay. Okay. To our viewer who wants to know if there's any such thing as overexposing to radiation, doing too many that has always been. I think a lot of patients have expressed that fear in the past, but the amount of radiation that you get with a mammogram is actually pretty negligible. It's a amount of radiation, and it's not one.
For those of you who are not speaking, could you mute your
It's a
mics,
cumulative
please?
dose of radiation. Yeah, yeah, it's usually a cumulative dose over time. So, basically, if you add that up, I don't know exactly, by example, dose of radiation that might be concerning. I guess, radiologists could tell you that, but usually over a woman's lifetime, say you start screening at age 40, you do your annual mammogram, say you do an annual mammogram every year till you're 70, which is about 30 mammograms. Your lifetime dosage of radiation, and this is just theoretically, should not provide any increased risk of cancer, right? Most people don't actually do a mammogram every year. In fact, some of the new screening guidelines recommend mammograms every 2 years, and not because of the radiation risk necessarily. Just because the thinking is, if you have a normal mammogram, the likelihood there is of you developing a cancer within that 1 year period between mammograms is actually pretty low. But and that's just for average risk women, not for high risk women. High risk women, and that's determined by your physician, who go all the risk factors that I mentioned. If you're a high risk person, then you probably should have your mammogram annually and not every 2 years. But usually, from what has been calculated, your radiation dose should not exceed potentially lethal dose. So you shouldn't exceed any, threshold dose of radiation, and it should not increase your risk of cancer just because each dose of with a mammogram is minimal.
We have another question from another Facebook viewer, and the viewer is asking, Doctor, when going through cancer treatment, deciding what you eat can be confusing, particularly when trying to eat healthy and managing energy levels and the immune functions. Can you list a few of these foods that may be beneficial?
Okay, so the general thing, people treatment, I know this, right, is very vague. Eat a balanced diet, eat healthy. And those tend to be very vague statements. What exactly does eating healthy mean? Um, in general, should eat, fruits and, fruits rich in things like antioxidants, like beta carotene, vitamin C, vitamin E, so that would be like vegetables and fruits, colored vegetables and fruits, like bright colored fruits, which have a lot of beta carotene in them. But generally, most vegetables and fruits are perfectly, healthy. What you should try to, there's nothing specific that to eat, but what you should try and minimize is the things that are not so good for you. For example, excessive amounts of red meat, excessive amounts of fried food, or foods that are high in saturated fats, right? So in general, those are the things you'd want to avoid. Anything else, but and you should try and have all your basic food groups, right? You should have your vegetables, you should have your starch, and you should have your source of protein. Does not have to be animal based, right? You can be vegan, you can be vegetarian, you can, pescatarian, where your main source of protein is from fish. But as long as you basically, the traditional foods that you're, because the whole idea is you want your body to be fighting shape, right? When you're undergoing cancer treatment, and I think you're probably typically referring to chemotherapy. You basically want to have your body in tip-top shape. You want to be at your healthiest and at your best, in order to withstand the side effects of chemotherapy. So, just basically, fruits, vegetables, things that are supposed to be, try to avoid fried foods, and definitely high fat diet is probably not a good idea. But there's nothing that you really have to completely, there's no absolute don't eat as far as I'm aware. But the best person to give you advice on that probably would be your medical oncologist and the person who is supervising your chemotherapy treatments. But in terms of surgery, as far as surgery is concerned, we usually just advise you to stay as healthy as you possibly can. I mean, if you don't think you eat a balanced diet, then maybe you might want to add a multivitamin supplement. Just to make sure that you're getting your basic trace vitamins, trace minerals and vitamins. If you're the kind of person, because of your work schedule, you're always eating probably irregularly and probably not eating the best diet. You're probably not having a good balanced diet. Your different food groups, then you might want to take in supplements just to make sure that you don't become deficient in any of these. So I hope that's helpful. I'm really a dietitian, and that's not my forte, but in general, that's what we usually advise our patients, just to definitely exercise. You should. Even if you didn't exercise before, now is the time to exercise.
All
Before,
right.
during chemo, probably not going to feel like exercise much. You're going to be very tired. But I find the people who are physically fit, who are exercising, eating well, tend to withstand chemotherapy a little bit better.
All right, Doc, we have another question for you from Lady Falsam Graham. She's asking, can fibrocystic diseases lead to breast cancer?
Okay, fibrocystic disease is not breast cancer, and it does not develop into breast cancer. What is fibrocystic disease? Basically, it's something that we see in childbearing age women a lot, right? It's basically changes that are seen histologically. That's, when we do a biopsy for other reasons, you see these changes in the breast tissue that are produced by the action of the female hormones on the breast tissue itself. So what does this look like? You see a lot of cysts, fibrocystic disease, just as the name says. You see a combination of fibrosis and cyst formation, if you were to look at it under a microscope. And how does this manifest itself? This is classically, women of childbearing age will come in with the breast get swollen and tender just premenstrually. And then after the menstrual period, the swelling and the tenderness goes away. but it's cyclical. It comes on every month, just a week or two before the beginning of the menstrual period. So, those are the kind, and a lot of women get, they feel lumps sometimes, or sometimes lumps are discovered on ultrasound, and they actually turn out to be cysts that can be usually diagnosed on ultrasound. And, it tends to, this is just the end result of the cyclical action of the female hormones on the breast tissue itself. It never becomes cancer. This is a totally separate, independent entity from breast cancer.
All right, thank you so much, Dr. St. Luce. As we wind down this evening session, I just want to say good night to Dion Potter, who is joining us via YouTube. Thank you for tuning in to our program. I have a final, and what if another comment from Falsum for Dr. St. Luce, what if you pass period age, your menstruation age?
I'm not sure what specifically they're asking me. What basically, if you're postmenopausal, is that?
Ms. Graham, could you confirm if you're referring to post?
Specifically?
Yeah, could you confirm if you're referring to
okay,
postmenopausal age?
Disease.
And
yeah, you
all right, go
can
ahead.
see fibrocystic disease, menopause. Yeah. Yeah, you can see fibrocystic disease in this menopausal woman. I mean, it's usually something that's present during childbearing age, individually in the perimenopausal and postmenopausal period. If you had fibrocystic disease when you're younger, chances are, when you're in your perimenopausal years and even for menopause, you can still see and experience fibrocystic changes in the breast.
All right, thank you so much, Dr. St. Luce. I'm not sure, you're cutting in and out. Okay, so Miss Graham is saying, yes, I'm referring to my above questions. So I believe you would have answered the question, Dr. St. Luce. Miss Graham, can you confirm if the question was answered? In the meanwhile, I'm going to go over to our ladies at Nagico as we wind down this evening's discussion. And I would like you to tell us, what would you like to leave our viewing audience with? What would you like them to know about the services that are being offered by Nagico Insurances?
Previously, we have longevity, and Nagico is fast, fair, and always there to cater to all your needs, your medical, general, and your life insurance needs. So contact us at your convenience when you can.
And could you give us your contact information and your email address, and so that our viewers, if they're interested in signing up for a policy, they can reach out to you? For those of you in Anguilla, and those that are not in Anguilla, they can always go online and complete an application form.
Yes, you can visit the online address is www.nagico.com. You can visit us in Anguilla. Our main branch office is located next to the library, opposite the high school in the valley. We have 2 agents. We have CC Insurance agents, and we have Fair Play Management Service, who are brokers. Or you can call us on 1-264-497-5940, where we'll be happy to assist. My email address is Sandra, Sandra.Brooks, BROOKS, at Nagico, NAGICO.com, or you can contact Mrs. Imogene, IMOGENE.Taylor, TAYLOR, at Nagico, NAGICO.com.
So much, ladies, and thank you so much for sponsoring this program. Lonette Bell James Knight, what message of hope would you like to leave with our audience tonight? You have been through a lot. You have been diagnosed with breast cancer, cervical cancer. What would you like to leave with our audience tonight?
For the general public, with cancer patients or not, do your regular screening. For me, I was mid-screen. I usually do my annual. So don't blame a doctor. A doctor is not somebody who, if I say at this time you're not, you have everything is fine. Within they can't predict what will happen before you come back to them. So ensure you do your regular screening. For those persons who have been diagnosed with cancer, I would say to them, listen to your doctors. Natural is good, but in certain circumstances, chemo is not a sickness, it's just a medication like a cough medicine. Cough medicines too have side effects. Do it. Listen to your body. Do it. Whatever side effects you're having, speak with your doctor on it. Have a conversation. Once you have that conversation, you will see the difference. And that is what I would leave with everyone. And also put God first. Once you have Him, no matter what the doctors say, because I've heard doctors say that um, the later stage, your lifespan decreases. But for me, from the time I was born, God knows my beginning and my end. So if my lifespan is 18 years, if it's 20 years, doesn't matter what I have, that was the lifespan that He created me for. So it's
Wow.
it's not it's not it's not what the doctors say. It's what He decides. So
Wow.
prayer is an essential element to any form of sickness, any every and everything in your life.
Wow, what a powerful message of hope. It's interesting that I was speaking with a young lady today, and she said she echoed the same sentiment. She was saying it really does. Many persons are arguing about the vaccine and different diseases, but at the end of the day, God knows your lifespan because He said, before you were formed in your mother's womb, He knew you. So He would have predicted how long you would have lived on this earth. So it really doesn't matter what happens at the end of the day. You were created for a purpose. And as long as you have to complete His purpose, He will preserve your life on earth. So I thought that was a very inspiring and powerful message from you, Lonette, someone who would have gone through two different types of cancers and came out victoriously. You can share your story to many persons today, and it's such a powerful message of hope. One more thing, Lonette, what scripture would you like to leave with our viewing audience? What scripture gave you hope when you were down? What scripture did you speak and confess until you saw the manifestation of what you wanted?
There too. Well, there's Psalms 121. I repeat it daily. The whole Psalms is not Psalms 121, and then Psalms 23, verse 4, where He says, "I will walk through, though I walk through the valley of the shadow of death, He will always be there with you. He'll comfort you." And where it says also, He will never leave you nor forsake you. Those are what have gotten me through.
All right. So, though I walk through the valley of the shadow of death,
Shadow of
I
death.
will
I will
fear
fear
no
no evil,
evil, and
for
He
thou
will
art
never
with
leave you nor
nor forsake me.
forsake you. Very
Yes.
powerful message. I'm sure many persons that are listening or who would listen after the broadcast will truly be inspired by your message. Just a few comments coming in from Lena Isaac. Amen, sister. I enjoyed the topic. Thank you so much for tuning in. And Falsam Graham is saying, this is a powerful piece of advice. So encouraging. Thank you, Mom, for your belief. Thank you so much for joining in. And the last, but by no means least, we will have Dr. St. Louis give her final comments, what would you like to leave our viewing audience with? What would you like them to take away from tonight's message?
Well, I think the audience should be quite rightly inspired by Ms. And I think it's an important message. It's important for her to speak to a lot of people, because I think a lot of people fear, this diagnosis. I tend to thought sometimes denial. Thing is denial because fear what is coming, and what I think is having people like Mrs. James to speak to other patients or to people who potentially become breast cancer survivors in the future lets you see that there is hope. There is there's hope, there's life after this diagnosis. You can beat, it's survivable. There's no reason that you shouldn't come forward and get diagnosed early, because this is something that is treatable. I think here in our society, a lot of people sometimes recognize things and just through fear they present, but she's living proof that you can fight this and you can survive. And if there's something that you're concerned about, speak to your doctor, get evaluated. Don't live in fear.
Thank you so much, Dr. St. Luce. And one of our viewing audience is saying, good program. Thank you for tuning in to our program. And I would like to thank the ladies from Nagico Insurance for gracing us with their presence. Thank you for providing our viewers with such insightful information. And also to you, Dr. St. Luce, for sharing the medical expertise as it relates to breast cancer and the different surgical procedures that can be taken. And to you, Lonette Bell James Knight, my fellow Toastmasters, thank you so much. You're such a great woman of purpose, and your message is so inspiring and powerful. And I just want to encourage you to continue to share your experience and your story, because you just never know who you will touch. And keep up the awesome work you're doing. We have a comment coming in from Falsam Graham. I would really like to speak to this lady one-on-one. I'm really encouraged. All right. So Lana, you're making a difference already. So thank you, thank you, thank you. And to all of you who have been tuning in from the onset, from the time we began in May until now, thank you so much for supporting our program. Thank you to the companies across the Caribbean who have supported the apex of training and development. Thank you for your unwavering support. We appreciate your support, and we thank you, Nagico Insurance, for coming on board to sponsor this program. I would also like to thank the Antigua Barbuda Cancer Support Community, Nurse Imelda Benjamin and her team. They're doing a remarkable job. And I also would like to thank Community Charitable Ministry. So for those of you who would like to assist cancer patients through Community Charitable Ministry, you can contact Nurse Imelda Benjamin, at the Celestibird Mount St. John Medical Center, and she can be contacted at 1268 722 1019. Again, 1268-722-1019. And Dr. St. Luce, if anyone would like to get in contact with you, how can they reach you? Dr. St. Luce, for persons that might be interested in getting in contact with you, how can they reach you?
Oh, I'm also at the Celestibird Mount St. John Medical Center. My number there is 484-2700, or I don't hear me, or 764-7105.
All right, we can hear you. And again,
That's
the
right.
ladies at Nagico,
Thank you.
could you share your contact details again?
contact details the website www.nagico.com. Via email, I am Sandra, Sandra.Brooks, BROOKS @nagico.com, or Imogene, IMOGENE.Taylor, TAYLOR @Nagico, NAGICO.com, or we can be contacted on 1-264-497-5940.
All right. Thank you so much. And next week, we continue the discussion with Dr. Don Major, all the way from the Bahamas. He is a surgical oncologist at the Princess Margaret Hospital in the Bahamas. Dr. Don will continue the discussion on breast cancer awareness, and he'll also be looking at different types of cancers. You really don't want to miss next week's program at 8 p.m. We also will be having a dietitian that has not been confirmed as yet. So come prepared with your questions. Remember to tell a family member, tell a friend, tell a colleague that the Apex of Training and Development, the Community Charitable Ministry, and the Cancer Support Community are hosting this program. We're all hosting this program to provide insight on cancer awareness and the importance of health and wellness. And again, this program is sponsored by Nagico Insurances, and they have been such a tremendous corporate sponsor. So for those of you who are joining us this evening, see you next week. And to learn more about the Apex of Training and Development Services, you can visit our website at www.apexonlinelearning.com. We are a regional organization. We not only promote education and training, but we also promote health and wellness. And we believe there's a correlation between health and wellness and productivity levels. This is why we have partnered with organizations such as Nagico, such as Community Charitable Ministry, and the Antigua Cancer Support Community to provide or to host this show. Once again, thank you so much for tuning in. I am your host, Cherry-Ann Casimir Hodge, and it was a pleasure having you in our company. And see you next week, same time, same place. God bless you. Have a wonderful evening.
Good night. Bye. Bye-bye.
Good night.
Good
Thank you.
night.
God bless you.